By the age of 65, nearly 50% of men and over 60% of women report a significant decrease in sexual activity. Whether due to health changes, life circumstances, relationship dynamics, or simply shifting priorities, this trend is incredibly common. And yet, despite how many people experience it, conversations around sexual health and aging remain surprisingly rare. Today, we're exploring a topic that deserves careful attention. What actually happens to the body when sexual activity slows down or stops after 60? And how can understanding these changes help support your overall health, dignity, and vitality? It's important to begin with reassurance. Not engaging in sexual activity is perfectly normal. There is absolutely no rule requiring intimacy to age well. Each person's journey is personal and valid, but for those curious about the science, research suggests that reduced activity, including reduced masturbation, may be associated with subtle shifts in blood flow, muscle tone, hormonal balance, and even emotional health over time. Sexual health and aging is a topic worth exploring, thoughtfully, and with respect for every individual path. Before we dive deeper, if you value compassionate, evidence-based discussions about thriving after 60, tap that subscribe button. Here, we explore health, aging, and vitality with dignity and care. Later in this video, we'll also reveal a surprising factor related to maintaining intimacy in later life, one that many doctors don't emphasize, that could make a real difference in your well-being. Stay with us, because knowledge truly is power. First, let's talk about blood flow and tissue health. One of the most important foundations of sexual health after 60 is circulation. As we age, blood vessels naturally stiffen and circulation efficiency decreases, affecting all organs, including the genital area. Reduced sexual activity may contribute to further reductions in blood flow to the vaginal walls in women and the erectile tissues in men. In women, declining estrogen after menopause already causes hormonal changes with aging, leading to vaginal dryness, thinning of the vaginal lining, and reduced elasticity. When sexual activity slows, the natural stimulation that encourages blood flow and maintains tissue pliability may lessen, potentially accelerating some of these changes. In men, decreased sexual stimulation can similarly impact erectile function, making arousal slower or erections less firm over time. However, it's crucial to remember, many factors influence these outcomes, including heart health, hormone levels, medications, and even stress. The absence of sexual activity alone does not guarantee these changes. Quick question: have you noticed any shifts in your health after 60? In circulation, flexibility, or energy levels? Feel free to share your thoughts or questions in the comments below. We would love to hear your experiences and what topics you'd like to see covered in future videos. Staying sexually active, even through solo intimacy, can help promote blood circulation and oxygen delivery to tissues. But for those who are not sexually active, other practices like regular aerobic exercise, pelvic floor exercises, and hormone replacement therapy, if appropriate, can also support blood flow and sexual health after 60. Next, how muscle tone changes after 60. Beyond blood flow, the muscles involved in intimacy also experience natural changes with age. This includes the critical, but often overlooked, pelvic floor muscles. The pelvic floor is a group of muscles that supports the bladder, bowels, and reproductive organs. During sexual activity, These muscles contract rhythmically during arousal and orgasm, helping to maintain their strength and responsiveness. When sexual activity becomes less frequent, the pelvic floor may receive less natural stimulation. Over time, this could contribute to pelvic floor weakening, which in turn might lead to urinary leakage, pelvic heaviness, or reduced sensation during intimacy. But here's the hopeful news. Just as muscles elsewhere in the body can be strengthened with exercise, so too can the pelvic floor. Pelvic floor health in seniors can be maintained and even improved through exercises like Kegels, guided physical therapy, yoga, and other movement practices that focus on core stability. For women, regular pelvic floor work can prevent or lessen prolapse symptoms and improve sexual comfort. For men, strengthening these muscles can support erectile function, bladder control, and overall confidence. And if maintaining intimacy in later life is something important to you, a strong pelvic floor can make a tangible difference, enhancing both physical sensation and emotional connection. But that's not the only factor at play when it comes to aging and intimacy. Now, let's look at a small organ that often causes big concerns after 60, the prostate. The prostate gland, located just below the bladder in men, plays a vital role in semen production. With aging, it's common for the prostate to enlarge, a condition known as benign prostatic hyperplasia, or BPH. This can lead to urinary symptoms like frequent urination, weak flow, or waking up multiple times at night. Interestingly, some observational studies suggest a possible association between frequent ejaculation and a slightly reduced risk of prostate cancer. Researchers theorize that regular ejaculation may help clear out prostatic fluid, reducing inflammation and potential cellular abnormalities. However, it's important to stress, these findings are correlational, not causational. Sexual health and aging are influenced by a wide range of genetic, lifestyle, and environmental factors. Maintaining intimacy may support prostate health, but it is not a guaranteed preventive measure. What is guaranteed to help? Regular checkups, early detection screenings, a healthy diet rich in anti-inflammatory foods, and discussing any urinary symptoms promptly with your healthcare provider. If you find value in exploring how aging affects intimacy and well-being, hit that subscribe button now. We share clear, evidence-based guidance tailored specifically for your stage of life. Don't go anywhere, because next we'll explore a powerful and often overlooked emotional side of intimacy after 60. Now, let's shift focus to the emotional benefits of intimacy, an often overlooked yet essential part of sexual health and aging. During sexual activity, whether shared or solo, the body releases powerful neurochemicals, including dopamine, oxytocin, and endorphins. These substances promote feelings of relaxation, connection, and well-being. They can lower cortisol levels, the body's main stress hormone, and enhance a sense of emotional resilience. For some, sexual activity, even solo intimacy, supports mood and sleep. For others, emotional needs are met through touch, affection, or non-sexual connection. It's important to emphasize, there is no single pathway to emotional health after 60. For many, practices like mindfulness, meditation, community involvement, and meaningful hobbies offer similar, and sometimes greater, emotional nourishment. Still, for those who enjoy intimacy as part of their lives, it can be a valuable source of joy, self-expression, and balance. Maintaining intimacy in later life isn't just about physical health. It can also contribute meaningfully to psychological well-being. We'd love to hear from you. What activities or habits have helped you feel your best as you've gotten older? Drop a comment below. Your insights help build a supportive community where every experience is valued. Of course, physical health and emotional wellness are deeply connected. Which brings us to another vital piece of the conversation: personal choice. When it comes to how aging affects intimacy, the most important factor is agency. Your decisions about whether, how, and when to engage in intimacy, including masturbation, are yours alone. Some people find that maintaining sexual activity after 60 remains a vibrant, essential part of their identity. Others find that their needs and desires evolve, and they embrace new forms of connection, pleasure, and self-care. Both experiences, and every variation between, are healthy, valid, and worthy of respect. There is no universal prescription for how intimacy should look after 60. Only you can define what feels authentic and fulfilling for your body, your relationships, and your sense of well-being. If this message resonates with you, don't forget to like this video. It helps support a growing space where health, aging, and intimacy can be discussed with dignity. Aging brings many natural changes. Beyond intimacy, other factors become increasingly important for maintaining vitality, including staying physically active through walking, strength training, flexibility exercises, or recreational sports, eating a diet rich in fiber, healthy fats, lean proteins, and a colorful variety of fruits and vegetables, prioritizing sleep hygiene and restorative rest, nurturing strong social connections, friendships, family ties, community activities, engaging the mind through learning, creativity, and meaningful challenges, managing stress and mental health with therapy, mindfulness practices, or spiritual exploration. Sexual health and aging form one piece of this intricate puzzle, but by no means define it. Whether intimacy remains central or shifts into a different role in your life, your health and fulfillment come from honoring the full range of human needs: physical, emotional, intellectual, and spiritual. Now, while changes with intimacy are often normal, there are times when speaking with a healthcare professional is important. If you experience any of the following, consider reaching out to your doctor. Persistent vaginal dryness, discomfort, or pain that affects daily life or intimacy. Changes in erectile function that cause frustration, sadness, or relationship strain. Urinary leakage, urgency, or pelvic pressure sensations. Emotional challenges such as anxiety, grief, or shame. Related to intimacy or body image. Questions or concerns about hormonal shifts, libido, or energy levels. Specialists like urologists, gynecologists, pelvic floor therapists, and mental health counselors are equipped to help, compassionately and without judgment. Many effective evidence-based treatments exist, from lubricants and hormonal therapies to physical therapy exercises to medications or counseling support. The key is recognizing that you deserve care that honors your experiences, your body, and your values at every stage of life. And if you appreciate having a space where these sensitive topics are handled thoughtfully, subscribe to our channel for more science-backed wellness conversations designed just for you. Up next, we'll wrap up this discussion with some final encouragement and a reminder that your aging journey is uniquely your own. Aging brings undeniable changes to the body and to the way we relate to intimacy, health, and connection. But aging also brings new freedoms. The freedom to define wellness on your own terms, the freedom to seek new sources of fulfillment, and the freedom to approach your body's changes with compassion, understanding, and empowerment. Sexual inactivity after 60 may be associated with some physiological shifts in blood flow, pelvic tone, hormonal balance, or emotional resilience, but it is not a guarantee of decline. The human body is dynamic. It adapts. And your choices, informed by knowledge, supported by self-care, and aligned with your values, play a powerful role in how you feel and function through the decades ahead. There is no one-size-fits-all solution to maintaining intimacy in later life. For some, occasional intimacy, shared or solo, remains a cherished part of self-care. For others, intimacy evolves into broader expressions of love, companionship, and creativity. And for many, physical intimacy may no longer be a priority at all, replaced by deeper emotional bonds, community connections, and personal growth. Every pathway is valid. Every experience is real. If this conversation helped you feel seen, supported, or simply informed, give this video a like. It helps others find respectful, evidence-based discussions on aging, wellness, and thriving through every season of life. As we conclude today, remember, your body is worthy of respect, no matter how it changes. Your choices are powerful and uniquely yours to make. Your health journey matters, and you deserve compassionate, informed care. Whether you're exploring ways to maintain intimacy, navigating natural changes with grace, or simply seeking to understand your body better, your journey is important. You are not alone. There is a community here, one grounded in science, respect, and humanity, ready to walk alongside you. Before you go, we invite you to subscribe to our channel. Here you'll find thoughtful, stigma-free conversations about health, aging, intimacy, and wellness, always approached with sensitivity and respect. And we would love to hear from you. What topics about healthy aging are you most curious about? Drop your ideas or questions in the comments below. Your voice shapes the conversations we have and helps build a community rooted in support, not shame. Thank you for spending this time with us today. Take good care of your body, your mind, and your spirit. You are worthy of health, happiness, and connection at every age. Until next time, stay well. And know that your journey is yours to honor. If you found value today, subscribe and join thousands of others embracing aging with knowledge, pride, and power.